Hi class, welcome to our first video on middle adulthood. In this video, you're going to be learning about the physical changes that are taking place during this stage of life.
In this chapter, we're going to be taking a look at physical development, including changes in sensory capabilities, reproductive changes, physical changes, and changes in brain functioning. We're also going to be taking a look at cognitive development, where we're going to be exploring concepts including intelligence, flow, expertise, work, and leisure in middle adulthood. And then we'll be taking a look at psychosocial development, where we'll be exploring such topics as midlife crisis, stress in middle adulthood, generativity, marriage, and grandparenting.
In this video, you're going to be learning about many of the physical changes that are happening during middle adulthood. When we think about middle adulthood, we're talking about approximately middle 40s to middle 60s. Think about someone that you know who's in their middle 40s and then compare them to someone you know in their middle 60s. There's some pretty significant differences between these two groups in terms of their overall health and even just their physical appearance. Now, the physical appearance changes because of some very specific biological processes that are taking place that you're going to be learning about in this particular video. As you learn about these, I'd encourage you to think about how a person experiences aging and how that may vary depending upon the culture that they live within and how that culture views aging. So think about our own culture. Do you think that American society tends to view aging positively? Or do you think that aging is viewed with some level of reserve, where we may feel as though it's not something that we want to experience, it's not something to look forward to? I encourage you to really think about the importance of the way that society views aging and views the older population and how people age. And this is not just physically, this is also cognitively. You'll find this to be true in the next video as well. So when we think about some of the physical changes that we see happening during this time, we can think about changes in skin, weight gain. We can think about changes in hair, graying of hair, thinning of hair. People will also become shorter and women reach menopause. So you're going to be learning about these changes and what is happening within the body that's contributing to these changes. Some of these changes are just natural biological changes, but some of what we see happening can be a factor or related to some of the environmental variables or choices that someone has made, whether it be unhealthy eating or not getting adequate nutrition or variables outside of that person's biology. So what we're going to be looking at in this particular video are the differences between primary and secondary aging. And you'll also learn about the sensory changes that happen during this period of time. And you'll learn too about many of the health concerns, including health concerns surrounding the heart and cancer. You'll also be learning about something called the climacteric, and you'll learn about the importance of sleep and what happens when people at this age experience sleep deprivation. You'll also be learning about the importance of exercise and nutrition during this stage, and you'll be learning about brain functioning in this stage as well. In contrast to many of the chapters in this textbook, I think you'll find that there is a significant amount of time dedicated to this particular topic of physical development and physical changes that happen during this time. And as we think about the effects of these physical changes on one's health and well-being, I encourage you again to think about culture, but also think about how these changes can affect one psychosocially. What is it like for a person as they age? How do they experience these changes? And what does this mean for them as they see themselves growing older and as other people see them growing older as well?
We all experience as we get older both primary and secondary aging. And when we think about primary aging, we want to think about the biological factors that are largely beyond our control. And it's really this basic notion that, like it or not, getting older is an inevitability. So primary aging includes age-related changes that are caused by biological factors and also molecular and cellular factors and oxidative damage. And then we also experience secondary aging. And secondary aging is the idea that our lifestyle choices are likely to impact how we age. And so when we think about things like our diet, physical activity, and stress, where we choose to live, these are all related to secondary aging. During middle adulthood, we begin to see that physical changes are more evident, and many individuals are going to see graying of their hair. For some people, this typically begins in the 30s. For others, it may begin earlier, and for others, it may begin later than this. But this is when it typically does begin in the 30s. And this is because our hair follicles produce melanin, and that is what colors the hair. And with aging, our hair follicles are producing less melanin. We also see thinning of the hair in middle adulthood, and this is because hair follicles produce less new hair and the strands shrink. We also see male pattern baldness, and this is related in men to testosterone decline. Also, we begin to see some changes in our skin, and so our skin becomes more dry and loses the underlying layer of fat, and this can cause us to look older and to have wrinkles. Also, we can experience a loss of muscle tone, and the skin may appear more droopy. And then we also may experience some dark spots and blotchy skin, and this can be aggravated by sun exposure. As we age, we are going to likely experience what's called sarcopenia, and this is the loss of muscle mass and strength that occurs with aging. And this is caused by a decline of growth and anabolic hormones, especially testosterone. It can also be caused by decreased physical activity, so we may be able to reduce this by engaging in regular physical activity. This can start as early as 40 years of age, and it contributes significantly to decreased life quality and an increase in healthcare costs and early death in older adults. Also, we see muscle to fat ratio changing, where fat accumulates more so in the stomach area, which of course then puts each of us at risk when we do experience this for a variety of health conditions. We know that increased fat in the stomach area is associated with hormonal changes, can cause hormonal changes in particular, and can also increase one's risk for heart disease and even some types of cancer. Lung capacity also tends to decrease with age, and there are a couple of different reasons for this. One, the thinning of the bones can change the shape of the rib cage and result in a loss of lung expansion. And then two, we experience weakened diaphragm muscles. So when we think about coronavirus and we think about the fact that age is a potential factor that can make coronavirus symptoms more significant or severe and increase one's risk of mortality, one of the reasons is because of the change in lung capacity. There are additional reasons as well. The changes in lung capacity can also result in shortness of breath and feeling more tired. This is usually minimal in healthy, active non-smokers, but it may have significant effects on smokers and people who have chronic lung problems. As one gets older, they are also at an increased likelihood of experiencing sensory changes like changes in vision. And presbyopia is an unavoidable age-related condition that causes near vision problems in people who are typically age 40 and over. And the gradual loss of vision can interfere with simple everyday tasks like reading, operating a smartphone or tablet, or working on a computer. This can be diagnosed through a routine exam, and there are many different treatment options for people who experience this. When we think about presbyopia, we might think about people wearing reading glasses, and that's a typical experience or typical need that people in middle adulthood have. One alternative to that is to use multifocal contact lenses, and these are similar to bifocal eyeglasses, and they're designed to provide clear vision across various focal points. Also, as one gets older, they are at an increased likelihood of having what are called floaters. And these are small dark spots or shapes that float across your vision. They can look like threads, spots, squiggly lines, or even little cobwebs. And for most people, floaters will come and go, and they often don't need treatment. But sometimes they can be a sign of a more serious infection, or they could be a sign of a more serious underlying health issue. So if someone is in middle adulthood and experiences floaters, then it's important for them to let their doctor know. Again, this could be normal, or it could be an indicator of something that might be more serious. And then also during middle adulthood, we see a decrease in scotopic sensitivity. In other words, the ability to see in dim light and to adjust to changes in light levels decreases. And we also see an increase in dry eye syndrome, where the eyes don't produce enough tears or the tears evaporate too quickly. On figure 8.3 in your textbook, there's an image of the interior of the human eye. And one of the causes of age-related changes to vision is related directly to the lens. As one gets older, their lens becomes less flexible or more rigid. And then this affects how the lens directs light onto the retina, which can then cause that nearsightedness that one experiences as they get older, where they need to hold their book further away from themselves or their phone in an attempt to read. Another sensory change experienced in middle adulthood is hearing loss. And this is not something that is uniformly occurring in the same way among all people. The amount of hearing loss is dependent upon the exposure to loud noises throughout a person's lifetime. It's really important that you're very conscientious about the decibel level of sound that you're exposed to. You may not notice that something is loud because you've gotten used to it. So in other words, you've habituated to it, and this could be causing hearing damage. You might also not notice something is loud because you don't hear very well. Perhaps you already have some hearing loss, and then this can further cause damage. And then finally, you may also not notice these subtle changes in hearing because they are so gradual. It's sort of, we could equate with weight gain. You know, you gain just a little bit every month, and then eventually you begin to really notice that you've gained weight. And the difference, though, between weight gain and hearing loss that's due to being exposed to loud sounds is you can lose the weight, but if you've lost hearing due to exposure to loud sounds, you can do nothing about it physiologically or intervention-wise other than wearing a hearing aid to resolve this issue. So there's not surgery that can help you to repair what is caused or to repair the underlying causes of this loss. The underlying causes of loss that is due to, or the underlying cause of hearing loss that's due to aging has to do with the loud sounds affecting what are called cilia that are in your inner ear. And these cilia, when they become damaged, they are not replaced. So it's very important that we protect them. And when we think about protecting our ears, we want to minimize the decibel level. And the decibel level that is probably most dangerous is decibel level, or the decibel level that could be dangerous is a decibel level of about over 80 decibels if we're regularly exposed to that sound, or perhaps 85. Conversational voices are about 60 to 70. If you want to know how loud the noise is that you're being exposed to, it's very easy to do. All you need to do is go online, look for an app that's put out by the National Institute of Occupational Health and Safety, and you can download a free app that will measure the decibel levels in your environment, and will let you know it will let you know if you're exposed to loud noise, which will then alert you as to the potential dangers as you look at those decibel levels. About 19% of 40 to 69-year-olds report hearing problems, and the increase there's an increase from 5.5% of adults under age 40. So we see a big increase as we move into middle adulthood. And in particular, when we think about hearing loss that is associated with aging, one of the issues is being able to detect high frequency sounds. So when we think about high frequency sounds, we might think about a child's voice. So a very young child or a child in early or middle childhood has a higher frequency sound. So if a person is a parent or a grandparent during this time, then these age-related hearing losses can affect what they're able to hear their grandchild or their child say. Also, there can be problems understanding speech in noisy settings where it can be difficult to differentiate the background noise from what another person is saying. And again, this tends to be worse for people who've had exposure to loud noises. So very important to protect your hearing. There are many different health issues that are of increased concern during middle adulthood, and one of those is heart disease. There are a variety of risk factors for the development of heart disease. This includes family history, smoking, poor diet, an increased body mass index. Of course, an increased body mass index can lead to diabetes and then high blood pressure. And this then is related to heart disease and heart failure. So it's important that we think about our lifestyle during this time. And it's really important that you begin thinking about your lifestyle before you enter into middle adulthood so that you are coming into that period healthy and you have control over those risk factors. Also, diet, another important diet factor is sodium. One of the problems that we're going to see in late adulthood is that sensory abilities like taste tend to decline. And so as you move into late adulthood, your ability to detect salty taste tends to be less intense, or it's not as strong. And so a person in late adulthood is going to likely put more salt on their food than they would have during earlier times of their lives. Now, this can be problematic because we know that heart disease continues from middle adulthood into late adulthood as a health risk. And so if someone is not conscientious of the amount of salt that they're putting on their food, this can increase sodium levels, which then can increase blood pressure and then increase one's risk of heart attack. Heart disease can include heart defects and rhythm problems, and many of you have heard of cardiovascular disease, which is where one experiences narrowed, blocked, or stiffened blood vessels, and a significant factor that contributes to this is atherosclerosis, where one has a buildup of fatty plaque in the arteries. Heart disease increases one's risk of heart attack, stroke, heart failure, and cardiac arrest. Just to give you an idea of how significant heart disease is of an issue in middle adulthood and then continuing into late adulthood, the American Heart Association estimates that 48% of US adults have some form of cardiovascular disease, including coronary heart disease, heart failure, stroke, or high blood pressure. In figure 8.5, we can see a comparison of a normal coronary artery and one that is narrowed. The one that is normal does not have the blockage, and we see normal blood flow. And then the one that is narrowed, we can see that there's a blockage, or at least somewhat of a blockage, where a person has abnormal blood flow, and this is due to the increased plaque in their artery. Changes in blood pressure during middle age can affect a lifetime risk for heart disease and stroke. And also, on a positive note, people who maintain or reduce their blood pressure to normal levels during middle age have the lowest lifetime risk of cardiovascular disease, while those with an increase in blood pressure have the highest risk. So what are we talking about with high blood pressure? High blood pressure means that the heart has to work harder to pump blood throughout the body. Blood pressure is measured by looking at systolic pressure and diastolic pressure. Systolic pressure is the pressure in the blood vessels when the heart beats, and diastolic pressure is pressure in the blood vessels when the heart is at rest. High blood pressure increases one's risk of heart attack, stroke, and kidney damage. When we think about risk factors, one risk factor is actually gender. It seems that men who develop high blood pressure in middle age will experience some sort of some variation of cardiovascular disease, some event associated with it by age 85. So 70% of men in middle age who have high blood pressure will have a cardiovascular disease event by 85. Women, the risk is a little bit less. And so women who develop high blood pressure by early middle age, let's say an average age of around early 40s, have a higher lifetime risk for cardiovascular disease than those who have maintained normal blood pressure. Their risk is at 49.4%. So you see a lower risk. It seems that men have a higher risk when they have high blood pressure than do women, but both have significant risks associated with high blood pressure. There are various lifestyle changes that one can make to reduce blood pressure. Many of these factors you are already aware of. Of course, losing weight. So if someone is overweight according to their BMI, or especially if they are in the obese category, losing extra pounds and losing in particular that extra fat around the abdominal area is going to be very helpful. Getting regular exercise, eating a healthy diet, reducing sodium, limiting the amount of alcohol, quitting smoking, cutting back on caffeine, and reducing stress. Each of these can help to reduce high blood pressure. As one moves into middle adulthood, there are also increased risks for cancer. Cancer can be considered a collection of diseases where the cells divide without stopping and spread into surrounding tissue. When we think about age, age is used in virtually all studies of cancer epidemiology and is one of the most studied risk factors for cancer. So age is an important factor because, again, as I just mentioned, cancer rates increase, or the risk of cancer increases with age. And this rate increases even more rapidly beginning in midlife. Also, I think it's important to note that when we think about what's happening during aging, this increases one's risk of developing cancer. So there are biological processes that are associated with aging that can make one at greater risk for developing cancer. But I also want to mention too that there are also some factors that are environmental that may influence these underlying biological mechanisms, and some of these can be modified so that the onset of cancer is delayed or even prevented. And this preventability of many cancers over a person's lifespan is supported by a substantial body of research. If we think of this from a positive standpoint, which I know can be difficult when we think of cancer, we can think about midlife and older age, not just as a time of increased vulnerability, but a time for an opportunity for expanded focus on prevention efforts. There's quite a bit of research that suggests that epigenetic alterations in our DNA that are that may result in an increased risk of cancer can be very significant. So let's think about what we mean by epigenetics. So epigenetics, it's the study of how your behaviors and how your environment can cause changes that affect the way that your genes work. And one way we can think about epigenetics and cancer, although we can think about this in many ways, but one way that we can think about it is we can think about how together the environment, our diet, and our lifestyle can contribute to cancer development by inducing epigenetic changes. And this is in combination with genetic makeup, and then this can result in a disruption of the cellular processes that eventually can lead to cancer. I say that this is just one way we can think about epigenetics because we can also think about epigenetics and its relationship to the study of treatment of cancer, which is, of course, beyond the scope of this class. But I think it's important to note that we do have some variables in our environment oftentimes, or some choices we can make that may reduce our risk of cancer, even if we have some predispositions. So lifestyle factors can be very important. When we think about lifestyle factors, we might think about smoking. If we quit smoking, this is going to reduce our risk of cancer, especially the longer that we've been without smoking. Also, increasing the consumption of fruits and vegetables. This helps with cancer prevention. Reducing alcohol use so that we're only moderately or minimally consuming alcohol. Caloric restriction has been believed to have a positive effect on our risk of cancer. Consuming whole grains, also having regular checkups. And then two, decreasing those sorts of variables in our body that are related to inflammation. So when we think about inflammation, inflammation is associated with obesity. We know that when someone's obese, that they can have chronic, kind of low-level inflammation, which is it's like a precursor for the development of some types of cancer. And then also too, when we think about obesity, we know that obesity can result in some hormonal changes that then can impact the development of cancer. So for women with obesity, they may have higher levels of estrogen if they have especially increasing obesity or fat cells around their midsection. So this increasing estrogen level then may fuel cancer. So decreasing that fat that's in our midsection can be very helpful in reducing our risk of cancer. When cancer has spread to a different body part from where it started, this is known as metastasis. And when this happens, the doctors will say that the cancer has metastasized. And the doctor may call one's cancer then metastatic cancer, advanced cancer, or stage 4 cancer. But these terms can have different meanings. So, cancer that is large but has not spread to another body part can also be considered advanced cancer. So it's not only metastasis that would lead someone to be diagnosed with advanced cancer, but metastasis certainly can be very dangerous for a person who has cancer. So really, when we think about the term metastasis, this happens when cancer cells are breaking away from the main tumor, and then they enter into the bloodstream, and as some of you know, also potentially the lymphatic system. And so these systems, the bloodstream and our lymphatic system, they carry fluids around the body. And so this means that cancer cells can travel far from the original tumor and then form new tumors when they settle and grow in a different part of the body. And metastasis can also sometimes develop when cancer cells from the main tumor, especially if like in the abdominal cavity, when they break off and grow in nearby areas like in the liver, lungs, and bones. Any type of cancer can spread, and there are many different factors that affect whether cancer metastasizes. And this can include the type of cancer. So some cancers are more likely to metastasize than others, how fast the cancer is growing, and then other factors about the behavior of the cancer. Cholesterol is also an important issue of concern in middle adulthood. And what you're eating now can affect your health later on. So for those of you who may be in your 30s and you're eating a lot of hamburgers, fried chicken, or other fatty foods, feeling pretty safe, you don't feel afraid of the longer term effects, actually the research suggests that this long-term exposure to even slightly elevated cholesterol levels can damage a person's future health. So cholesterol is something all of us need to be thinking about, not just individuals in middle adulthood. So what is cholesterol? It's a waxy fatty substance carried by lipoprotein molecules in the blood, and it's necessary to create hormones and digest fatty foods. Now, most are low-density lipoproteins. Now, the high-density lipoproteins, they're actually good. That's a good type of cholesterol. And so when you go to your doctor and you get a physical, they're going to measure both your LDL and your HDL. It's the LDL that is that's going to be of concern to your doctor in terms of its ability to form plaque in the arteries, leading to an increased risk of heart attack and stroke. And I just mentioned the HDL, or high density lipoproteins. And again, we think of this as the good cholesterol. So your doctor would also be interested in knowing about this level. And this is good because what it's doing is it's carrying cholesterol from other parts of your body back to your liver. And then your liver then removes the cholesterol from your body. So this is a good type of cholesterol. Also, your doctor is going to want to measure your triglycerides. Triglycerides are a type of fat that's found in your blood, or we could think of it as a lipid when we think of the word fat. So when you're eating, your body is converting any calories that it doesn't need to use right away into triglycerides. And then those triglycerides are stored in your fat cells. And then later, hormones release triglycerides for energy between meals. When someone has high triglycerides, this can contribute to hardening of the arteries or thickening of the artery walls. Like we talked about a moment ago, we talked about how this then can result in some blockages in our arteries, which then can result in reduced blood flow. And then this can increase our risk of stroke and heart attack and heart disease, especially if someone has extremely high triglycerides. I want to mention too that extremely high triglycerides are not only dangerous in their risk of stroke, heart attack, and heart disease, but they can also cause an inflammation of the pancreas, which is known as pancreatitis. For some people who have other underlying health conditions, this can also increase one's risk of having higher triglycerides. So some conditions like metabolic syndrome or obesity, when we could think about someone whose BMI is over 30, the person may have high levels of triglycerides. This could also be a sign of type 2 diabetes or prediabetes. Now, also some medications can increase triglycerides as well. So because we know triglycerides can increase one's risk of having heart disease and stroke, as well as heart attack, it's important to think about ways you can reduce your triglycerides. But the only way you're going to know what the level is if you go to your doctor and you get a physical. And we really need to be doing this at least once a year, no matter what your age is. We need to, when we think about how to reduce triglyceride levels and how to positively affect cholesterol, we need to exercise regularly. We need to avoid sugar and refined carbohydrates. So in other words, when we think about refined carbohydrates, we're talking about foods that are made with white flour or fructose. We want to lose weight. So, especially if we have extra weight around the waist, we want to choose healthier fats. Fats are not bad. They're not the enemy, but we need to trade the fat that we might be getting from meat for healthier fats, like those that are found in plants. Like, we've all heard about the positive effects of olive oil. So think about also the positive effects of fish. Especially when we think about fish, we think about omega-3 fatty acids. And these are very important for our overall health. And then reducing the amount of alcohol that you consume if you do tend to consume a lot of alcohol. So limiting alcohol can have a positive effect on your triglyceride levels.
In middle adulthood, it's very important that people are aware of their HDL levels. In other words, their high density lipoproteins. And so when they go to their doctor for their annual physical, their doctor's going to measure their HDL levels, and they're also going to be measuring their triglycerides. So high HDL levels can reduce the risk of heart attack and stroke. And so we think of this as being good cholesterol. And then triglycerides are a type of fat in the blood that's used for energy. And when these are high, this can increase a person's risk for heart disease and stroke. Now, some people are genetically predisposed to having higher cholesterol levels and higher triglyceride levels. However, much of this is attributable to diet and lifestyle. And so it's of great importance that during this age that people are getting exercise and that they're also eating healthy.
The risk for developing diabetes is at its highest in middle and late adulthood. The most common type of diabetes diagnosed in adulthood is type 2. As you can see here, 90 to 95% of adult cases of diabetes are type 2 diabetes. Early on, before someone develops diabetes, what you'll find is they'll experience what's called insulin resistance. And insulin resistance occurs when you have excess glucose in the blood. And then this reduces the ability of the cells to absorb and use blood sugar for energy. And then this increases the risk for developing prediabetes and then eventually type 2 diabetes. So if the pancreas can make enough insulin to overcome the low rate of absorption, then diabetes is less likely to develop, and then blood glucose is going to stay within a healthy range. But for people who have certain risk factors or, and perhaps have a certain diet, they're at a greatly increased risk of developing insulin resistance, then prediabetes, and then diabetes. Some of these risk factors include obesity, especially when the weight is around the midsection, around that abdominal area like we talked about. Having a sedentary lifestyle, very significant. We know that having a sedentary lifestyle can increase one's risk for lots of different health conditions and also lots of precursors to some significant health issues. And this is just one of them. We also know that smoking can increase one's risk of developing insulin resistance, prediabetes, and then eventually diabetes. And then sleep issues. That might be one that you hadn't thought about, but this is significant as well. And so when we think about a person who's obese and who has sleep apnea, now we're seeing some additional factors, or a factor in addition to obesity, that's contributing to their potential risk of developing insulin resistance, then prediabetes, then diabetes. Another is high blood pressure, and high blood pressure has been linked to an increase in insulin resistance. I wanted to share with you some of the symptoms of diabetes, just because simply it is not, it's very common or relatively common in middle adulthood and late adulthood, especially as we see this obesity epidemic that we have in the US and an increase in the rates of a sedentary lifestyle. So some of the symptoms, and you all have probably heard these symptoms before, but this is just for your own personal awareness: having an increase in thirst, frequent urination, extreme hunger, unexplained weight loss, fatigue, irritability, blurred vision, slowed healing, and frequent infections. So these can all be some potential symptoms. Again, it's important for you to have regular checkups with your doctor, and if you notice anything that is out of the ordinary, for you to talk with your doctor and then to make these important lifestyle changes like I had mentioned. Also, there are different rates among racial and ethnic groups. I visited the American Diabetes Association website so I could share with you some of the statistics related to race and ethnicity and the overall rates of diagnosed diabetes in adults. So this is based on diagnosis. There are, of course, people who have not been diagnosed, who may lack medical care or who may not be fully aware of that their symptoms are indicative of diabetes and have not gone to talk with their doctor about this. But just to share with you the rates, the highest rate is among American Indians and Alaskan Natives at 14.7%. And then the next highest is at 11.7% for non-Hispanic Blacks, and then 12.5% for Hispanics, 9.2% for Asian Americans, and 7.5% for non-Hispanic whites. Among Asian Americans, the lowest group is among Chinese, with the highest group being among Asian Indians. And so we can break this down further by race. We can also look at Hispanic adults, and the highest rate of among all Hispanics is among Mexican Americans, and then next is Puerto Ricans, and then Central and South Americans, and a very relatively small percentage of Cubans. So we can think about the lifestyle factors that might put an individual at risk. We can also think about the other demographic factors that might put an individual at risk, and there may be some additional biological factors that are putting certain groups at risk. So again, some increased some factors that increase risk include diet, obesity, inactivity, and of course family history. We know that when people develop diabetes, it's not just about having the increased risk of having heart disease and stroke and other health issues, but there are some significant health issues that are often, that can be uniquely or fairly uniquely tied to diabetes. For example, limb amputation. So when someone has diabetes, they are at an increased risk of this. And the reason that this happens is because of something called peripheral artery disease, where your blood vessels narrow and you have a reduced blood flow to your legs and to your feet. You can also experience nerve damage, and some of you may have heard, or you may know people who are diabetic who have peripheral neuropathy, especially if they have uncontrolled diabetes. And the problem here is that when someone has peripheral neuropathy, this could prevent them from feeling pain that would be associated with some underlying issues associated in their feet with diabetes. And so if you can't feel pain, you might not recognize that you have an ulcer or a wound on your feet. And this could then, you may continue to put pressure on that area, and this can then cause the injury or the ulcer to grow and to become infected. And then when we think about peripheral artery disease, where you have a reduced amount of blood flow, this then can slow wound healing, and it also reduces your body's ability to fight infection. And so some individuals who have diabetes are at an increased risk of this tissue damage to their feet, or or the death of the tissue, which we may think of as gangrene. And and this infection could spread to a person's bone. Now, if the infection isn't stopped, the person may have to have amputation. And the most common amputations in people with diabetes are the toes and the feet and the lower legs. Before I move on, I just wanted to mention something that I didn't mention a moment ago as we were looking at diabetes, and I mentioned type 2. I wanted to share with you what type 1 diabetes is, and this was once known, for some of you, you may have heard of this as juvenile diabetes or insulin-dependent diabetes. And this is a chronic condition where the pancreas is producing little or no insulin. So when we think about some of these health consequences, some are associated with both type 1 and type 2 diabetes. One in particular that is retinopathy. Now, the cause of retinopathy, and you might have heard of it as diabetic retinopathy, it's caused by damage to the blood vessels of the light-sensitive tissue that's at the back of the eye that's known as the retina. And so, at first, when a person has diabetic retinopathy, they may not have any symptoms or perhaps mild symptoms, and then eventually this can cause blindness. This can develop, just like I said, in both people who have type 1 and type 2 diabetes. And the longer you have diabetes and the less controlled your blood sugar is, the more likely you are to develop this particular complication. Diabetes can also affect one's heart. So over time, what's happening is high blood sugar levels, that can damage blood vessels and the nerves that control your heart. And so you're then more at risk for developing heart disease or, more specifically, some conditions that then increase your risk of heart disease. So people who have diabetes are at an increased risk of high blood pressure, too much bad cholesterol, which we talked about a moment ago, and then higher triglycerides. And so these are factors that increase one's risk of heart disease or heart attack. And the problem is that none of these, high blood pressure will generally, unless it gets extremely high, this does not typically, easily show up with symptoms. And then high cholesterol and high triglycerides, more specifically, those don't really show, they're not easily showing up. It's not like you just realize you have high cholesterol or high bad cholesterol and high triglycerides. You wouldn't know that unless you were to get your annual physical examination. That's, again, another reason why we need to make sure that we are regularly getting our physical examination. If you don't have health insurance, or if you're, if it's too expensive for you to get the physical examination, visiting a community health clinic for some individuals, depending on where they live and what the clinic offers, could be an option. And often those, the fees are based on a sliding scale based on income, or they, for many people, they may be, the fees may be, removed so that you don't have to pay anything. Diabetes can also cause changes in blood vessels that can increase your risk of stroke. In particular, I think that a person, what I recall recently reading is that a person who has diabetes is at a 1.5 times risk of having a stroke when compared to someone who does not have diabetes. And of course, stroke comes with many different, can come with many very significant outcomes for the individual. And although we'll be looking at stroke a little bit later in the next chapter, and most of you probably know what a stroke is, but a stroke happens when the blood supply to part of your brain is suddenly interrupted and then the brain tissue is damaged. Most strokes happen because a blood clot has blocked a blood vessel in the brain or the neck, and the stroke can cause a lot of some very significant consequences for the individual. For some people, the stroke may not be very significant, but for many people it can be, and it's certainly not worth the risk. So some of the problems can be, movement problems, pain, numbness, and problems with thinking, remembering, or speaking. Some people may also, they may not survive the stroke, so it can be deadly. Another health condition that one is vulnerable to in middle adulthood is one I already mentioned, but I'm just going in the order of what's presented in your textbook. I think it is probably easier for you as you think about the questions that I have on your student learning guide, and then also as you're reading the textbook. So metabolic syndrome is it's really a cluster of conditions that can occur together, and it increases one's risk of heart disease, stroke, and type 2 diabetes. And so the conditions that are occurring together include increased blood pressure, high blood sugar, and excess fat around the waist. and high cholesterol and triglyceride levels. And metabolic syndrome has become increasingly common, with about 1/3 of adults in the United States having it. And there are significant consequences for metabolic syndrome. I think one significant factor that we need to think about, and that is more recently, at least relatively recently in our understanding of metabolic syndrome and of other related conditions, is inflammation. And we know inflammation is a potential factor in many different disease processes. And so we want to get that inflammation under control. And so if you have that, and one of the factors that contributes to inflammation is obesity, and we know that obesity is a risk factor for metabolic syndrome. And again, remember, when we think about inflammation, we're talking about chronic inflammation. So this chronic, even low level of inflammation is causing your body to be in a state of fighting against things that might harm it. And so this is inflammation on its own is important when you're injured. It's important when you have an infection, or you've been exposed to some sort of toxin. But chronic inflammation is where this inflammation response that we have that's healthy is lingering. And then this leaves your body in a constant state of alert. And this then can have a negative impact on your tissues and organs. And as I'd mentioned earlier, there's research suggesting that chronic inflammation can play a role in some types of cancer. Now, there are some signs of chronic inflammation, and this can include being really tired, having fever, rashes, abdominal pain, and chest pain. And again, like I mentioned, obesity is a risk factor for chronic inflammation. Also, I should mention too that smoking is, and chronic stress. So metabolic syndrome, one of the important components of it, or one of the factors of one of these interrelated factors, is obesity. And among people who are obese, they tend to have a larger waist circumference. Now, you don't have to be obese to have metabolic syndrome. You can still be at risk for metabolic syndrome without, perhaps being in the overweight category and having a larger waist circumference, or even being in the normal weight category. And it may be you're in the normal weight category because your weight is unevenly distributed. So having that bigger belly is going to increase your risk of that. And then high blood pressure is another one of these interrelated symptoms, and then elevated triglycerides. And like I mentioned, about 1/3 of US adults has this, and it increases one's risk of diabetes and cardiovascular disease. And there are many important lifestyle factors that we can make, or that we can change to address the symptoms that we have of metabolic syndrome, so that, or these interrelated symptoms, so that we don't have this and we don't have the increased risk for these health problems. And in particular, losing weight and increasing physical activity can be of great importance and great benefit.
Another health concern in middle adulthood is something called rheumatoid arthritis. And this is an autoimmune and inflammatory disease. And so what this means is that a person's immune system attacks healthy cells in their body by mistake. This then causes inflammation or painful swelling in the part of the body that's affected. Rheumatoid arthritis affects the joints, and many of you have probably seen commercials for drugs that target rheumatoid arthritis. And so you might be aware of what some of the symptoms are. So you might know that rheumatoid arthritis commonly affects joints in the hands and the wrists and in the knees. So in a person who has rheumatoid arthritis, the lining of their joint becomes very inflamed, and this then can cause damage to joint tissue. And this tissue damage can cause some long-lasting or chronic pain. It can also cause some lack of balance, which then increases a person's risk of injury and other problems, and it can also cause deformity. One of the things that I think can be pretty scary for a person if they get this diagnosis is that rheumatoid arthritis can affect other tissues throughout the body, and it can cause problems in organs like the lungs and the heart and the eyes. So getting an early diagnosis is going to be important so that a person can get the medication that they need, so that they can delay or slow the spread of of symptoms throughout their body and delay or even prevent some of the negative effects that rheumatoid arthritis can have on a person's overall health. Rheumatoid arthritis in particular is an issue during middle adulthood because a person's risk for this increases as they get older. But I also want to point out that people who have a genetic predisposition seem to be the ones who are most vulnerable. But it seems that it's a genetic predisposition plus environmental variables that trigger its development. And the specific variables that can trigger its development are obesity and smoking. So these are variables that are under our control. Unlike osteoarthritis, which of course can lead to disability, this particular type of arthritis can actually lead to premature death. So it can be a very serious condition for a person. It can also contribute to some premature heart issues or heart disease. So again, it's important when a person is experiencing symptoms of painful swelling and stiffness, and as you can see here, some loss of function of the joints, that they talk with their doctor and that they see someone who's a specialist, and they can identify if what they're experiencing is rheumatoid arthritis or if it's osteoarthritis. Now, blood work can help in identifying whether or not it's rheumatoid arthritis, and this is because blood work can show a doctor if a person has something called Rh factors. Also, x-rays can be very important too, because x-rays will show what type of arthritis a person has. So we don't want to just make the assumption that it's osteoarthritis when in fact it could be rheumatoid arthritis, which really requires that a person get specific types of interventions.
Figure 8.8 of your textbook shows the difference between a normal joint and a joint that's affected by rheumatoid arthritis. And if you'll notice here, the affected joint, we see a swollen joint capsule, we see an inflamed synovium, and we see some bone loss and erosion and cartilage loss. So this then is what's contributing to the pain that a person has with rheumatoid arthritis. And again, untreated, this is going to get progressively worse. And there are many different treatment options out there, fortunately. During middle adulthood, there's also an increased experience of heartburn, and this is stomach acid that's backing up into the esophagus. It's sometimes linked to eating fatty or spicy foods, drinking caffeine, smoking, and eating before bedtime. One disease that is more common during middle adulthood and also in late adulthood is Gerd. There are many different medications that are available to treat this. Some of them used to be prescription and now are available over the counter. It's very common for people to have Gerd, and this is where the lower sphincter muscle in the esophagus relaxes too frequently and the stomach acid flows into the esophagus, and this can be very painful for a person. And it can also injure the lining of the esophagus and increase one's risk of esophageal cancer in the long term. Gallstones are another health concern in middle adulthood. Gallstones are hard particles that develop in the gallbladder, and they're made of fatty materials, bile pigments, and calcium deposits. And they can block bile or pancreatic ducts. And some risk factors include family history, which we can't control, but we can control high-calorie diet, one that's high in carbohydrates, diabetes, metabolic syndrome. Other risk factors include Crohn's disease and obesity.
Each of you in this class are at your own unique stage of life. We have many students who are in emerging and early adulthood. We also have students who are in middle adulthood, and we have some who are in late adulthood. So at every stage of life, we face different challenges to sleep. But often, sleep starts to get increasingly complicated during middle age. Changes to hormones that influence sleep and circadian rhythms, and a greater risk for the presence of health conditions that may interfere with sleep, and the presence of chronic stress are some of the most common reasons that sleep tends to become increasingly challenging as people get older. So as we think about some of these changes, let's first take a look at women. So during middle adulthood, women are experiencing both perimenopause and menopause, and both of these can bring significant challenges to sleep. So for example, I recently read an article where the researchers suggested that more than half of women who were perimenopausal, and that means that they are preceding menopause. They haven't yet gone through it, but they're experiencing some of the symptoms that are indicating that they're moving towards menopause, that 56% of them sleep less than 7 hours a night on average. That's a very big change from a third of women who are premenopausal who are sleeping less than 7 hours nightly. So that's a significant change. If we reflect back on what we learned about sleep, we can see that this is a very important or significant change. And we know how important sleep is for our overall physical health, our cognitive abilities, and for our emotional health. So we can see this tie then between sleep or lack of quality sleep and all of those particular domains. Women at this stage, especially those who are perimenopausal, often report too having difficulty falling asleep and then staying asleep. So we see some increased risk for insomnia. And many women also report that when they wake up, they feel tired rather than feeling rested. Now, I want to point out too that it's not just women who experience these changes in sleep. Men also experience some changes, and these changes are a result often of hormonal changes that are commonly experienced among middle-aged men. And one of these changes, one of these significant changes, is a natural reduction in testosterone. And this can have an effect on sleep quality. And I also want to point out too that this can become sort of a vicious cycle because short sleep actually suppresses the production of testosterone. So here we see a natural decline in testosterone, which has an effect on sleep quality. And then we see an effect of the short sleep or not getting enough sleep on testosterone. So we see this cycle begin to emerge. So this suppression of testosterone contributes to more sleep and sleep-related health issues. And some of these include things like obstructive sleep apnea and also insomnia. What you'll also find during this stage is that what people tend to spend time in during sleep changes as well. So think about the stages of sleep. You learned about stages 1, 2, 3, and 4, which are collectively known as non-REM. And then we have REM. Now, 3 and 4 are known to be the most restorative stages of sleep. And then REM is of particular importance for things like memory consolidation. So what researchers have found is that people spend less time in deep sleep, and this means they're getting less restorative sleep. And they're also spending slightly less time in REM sleep. So you can then think about the consequences of this. The body is not getting the restoration that it had been getting before. And then as we think about how important REM sleep is for memory consolidation, we can understand then how memory changes may take place during this stage, especially if a person is getting less than the amount of sleep that their typical counterparts are. Then we're really going to notice that it's very evident that they're not getting that sleep or that there's something different about them in terms of their ability to remember things. So sometimes when people have difficulty recalling information or focusing during this stage, it could be due to a sleep disorder. Not getting that good quality sleep can have a significant effect on cognitive functioning. It can also cause irritability, and overall it can affect mood. So I want to point out too that when someone's not getting enough sleep, that immune functioning can be impaired. And so then we already see some vulnerability because the person's aging, and then we can couple this with not getting good quality sleep, and then the result of that being reduced immune functioning. And you put these together, then we see a dramatically increased risk, especially if a person's getting very little sleep or very little good quality sleep, in that person's vulnerability to illness. And there's a lot of research suggesting that when people aren't getting good quality sleep or enough sleep, that they're at an increased risk for hypertension, for cancer, and diabetes, just to name a few of the potential risks. So I'd encourage you, if you know someone during this stage of development, or if you are that person and they're not getting the quality of sleep that they need, if they're feeling very tired throughout the day, They're not feeling as though they're able to function as they used to. And especially if their sleep partner's reporting that they're snoring during the night, this could be an indicator of sleep apnea. And it's important that a person gets treatment because there are some very significant risks associated with not getting that good quality sleep. And that can happen when someone also has an untreated sleep disorder like sleep apnea.
Overall, we can see here how important lifestyle factors are in contributing to good health during middle adulthood, and that the choices that we make early in our lives, even for many of you who are in emerging adulthood, early adulthood, and for some of you who are in middle adulthood, the choices we make now can significantly affect us long term. We don't want to wait until we're older to make good choices. The research suggests that we need to be starting early in our lives. So we need to get a good amount of physical activity. For people in middle adulthood, it's important to get 150 minutes per week of moderate intensity exercise, including at least 10 minutes of aerobic exercise. Muscle strengthening activities are important too, especially when we think about women and their changes in hormone levels. The decreasing estrogen can lead to an increased risk of osteoporosis, and so that muscle strengthening can help to strengthen those bones. And really, any activity can have health benefits. It doesn't have to be a specific type of physical activity that we think of as being directly geared towards that's a program or that we typically think of as physical exercise. It could just be a nice long walk each day with your family. It could be that you are where you work. Maybe you work somewhere where it's a large facility, and walking the long way each day. So we can do things that don't have to be as don't have to be so much that we're dedicating a lot of time each day to physical activity. Even small lifestyle changes can make a difference. Nutrition, again, important, related to overall health in middle adulthood. And there are some important recommendations that I would encourage you to read about in your textbook. And then two, what we see in middle adulthood is a decrease in metabolism. And so what you used to be able to eat when you were younger and maintain a certain weight, now you might find that weight creeping up. And so it's important that adults are increasing their exercise, eating less, and watching their nutrition. And then remember, we talked about lots of the physical health problems associated with obesity. Another problem involves cognitive risk factors, and in particular, an increased risk of dementia, which we'll be looking at in the next chapter. And this is because fat cells may produce harmful chemicals that promote inflammation in blood vessels in the brain. So here again, we see that inflammation affecting us. In middle adulthood, we see a decrease in fertility, and this is a period that's known as the climacteric. And this is biologically based, but can be affected by the environment. We also know that it's not only women who experience a reduction in fertility, but so too is this the case in men. Although men can reproduce throughout their lifetime, the ability to reproduce declines. And for women, they lose that reproductive ability as they go into perimenopause and then into menopause, where they are no longer ovulating. For women, perimenopause is the beginning of the change in hormonal processes. And this is where the ovaries stop releasing eggs and hormone production decreases. And then menopause is identified when a person is 12 months, they've had 12 months without menstruation. There are multiple possible effects of menopause, including hot flashes, then changes in sleep, painful intercourse, increased osteoporosis risk. And then two, there can be some psychological effects, including depression and irritability and weight gain. But this seems to be perhaps tied to the psychological effects of the experience of aging. And so I wonder, as you think about this, what do you think the cultural, our own culture, how does our own culture view menopause? How does our culture Figure 812 in your textbook illustrates the symptoms of menopause, and some of those include changes in joints, including soreness and stiffness, urinary incontinence or urgency, also shorter or longer menstrual cycles as one is transitioning into menopause, and then also changes in weight, so increase in weight gain, sometimes night sweats and palpitations, and thinning of the skin, drier skin, hot flashes like I mentioned a moment ago, and also back pain. And so these are just some of the symptoms one might experience. Many years ago, many women would seek hormone replacement therapy when they were experiencing menopause, but most women are opting not to do this because it's been associated with breast cancer, with stroke, and the development of blood clots. And so there's been a greater emphasis on non-hormonal treatments like eating soy, practicing relaxation, and avoiding caffeine and alcohol. There are ethnic differences that have been researched that are related to menopause. So white women are more likely to disclose psychosomatic symptoms, and this would include psychological and cognitive symptoms, including depression and irritability, forgetfulness, and headaches. And you notice here also, and in your readings, that African American women are more likely to disclose vasomotor symptoms. And vasomotor symptoms refers to vasomotor center of our brain that regulates things like our blood pressure. And so African American women are more likely to report hot flashes, night sweats, and flushing. And research suggests something interesting in that Japanese and Chinese women report the fewest of symptoms. It's thought that this possibly could be due to diet. And so when we look at a traditional Japanese diet, for example, there is a lot of soy, and this might be useful in preventing hot flashes in women. So edible beans like soybeans, these contain estrogenic compounds that are helpful potentially in reducing one of the most reported effects of menopause among American women, which is hot flashes. I want to point out too that there actually, in one article that I read, the author suggested that there is actually no Japanese word for hot flashes. When we think about menopause, we need to think about not only the biological effects, but the psychological effects. And so menopause and the experience overall among women is likely going to vary across cultures because of the different thoughts that women have about losing their youth and getting older. So, is menopause viewed as a liberating experience, or is it viewed as a loss of youth and womanhood? And this may depend on expected social norms, and it may also depend on the cultural views of aging. So when we think about women in the United States, when we think specifically about Caucasian women, we can think about the numerous messages in the media that are negatively related to aging. And so when we think about then, contrasting that to a culture, for example, like in Asian cultures where they tend to revere the older population, we may see different experiences that women have related to menopause.
So what have you learned about in this video about the physical changes that occur during middle adulthood? You learned about the differences between primary and secondary aging, and you also learned about the sensory changes that happen during this stage of development, including changes in hearing and vision and why these changes happen. You also learned about many of the health concerns in middle adulthood, including those related to the heart and cancer. You also learned about something called the climacteric and how this happens for females and for males. You also learned about the importance of sleep and some of the consequences of sleep deprivation. And you learned too about the importance of exercise and nutrition for optimal health. And then you also learned about brain functioning in middle adulthood. What will you be learning about next? In our next video, you're going to be learning about the cognitive changes that are happening during this stage of development. I look forward to seeing each of you online. And as always, should you have any questions related to any of the material that you're learning about, anything that you're reading about, anything in any of the videos, or if there's anything in general that I can help you with in this course or while you're a student at Northeast State, please don't hesitate to reach out to me.